So on to the exciting panel discussion that we're going to be having. I just need to open our link for the panelists. I want to thank the panelists for joining us, and I want to introduce first Raj Uppal. She is the current full-time president for the Canadian Union of Public Employees at Local 41. She represents 1,400 members working at Grey Nuns Community Hospital and the Edmonton General Continuing Care. Raj also serves as the diversity vice president for CUPE Alberta, and she's the chair of the CUPE Alberta Health Employees Committee. So thank you, Raj, for joining us. We have Cam Heenan, who is an active duty paramedic, and he has been so for the past 20 years and a good labor advocate. During this time, he's had opportunity to work in numerous settings, from rural to metro environments, and he's, like I said, an impassioned advocate, not only for EMS, but for the rights of workers. And finally, we have Eyasu Yakob, who is a nursing student going into his final years of study at the University of Alberta. He served as president for the Canadian Nurses Students Association from 2023 to 2024, where he represented nearly 30,000 members. He is also starting an exciting summer job as working in research for the Canadian Federation of Nurses Unions as a summer student. So welcome, all of you. So to begin with, I'm going to ask that you just talk about your feelings in general about what we're facing in the healthcare system, which is a huge staffing crisis. And I don't need to tell you about it. We're here to hear your impressions about what's happening and what your feelings are. And I do have some questions that I'll ask after you give your opening statements, and there'll be an opportunity for those in attendance to ask questions and answers. And Chris, if you can help me moderate those questions, that would be great if you see them and I haven't got to them yet. So why don't we start with Eyasu? I'll let you start with some opening statements, please.
Thank you. Well, hello everyone. My name is Eyasu, and I guess what I would like to do is just provide a bit of a student's perspective on the broader issues that are currently being faced in healthcare, as I feel there's a lot of understanding about how patients and families are impacted in terms of the difficulty in accessing care and high quality care at that, as well as the impacts, various staff members face in terms of very high burdens on the job site and just difficulties within their working conditions. However, I feel like students are perhaps an overlooked kind of demographic when discussing the crisis in healthcare, especially as there's lots of talk about the need to recruit more students and bring more people into the fold of healthcare, as they're also facing many challenges that don't get talked a lot about in the media, in terms of when you have staff members who are overburdened with very high assignments of patients and they don't have much to give due to how burnt out they're feeling, it places them in a difficult situation to then pass on knowledge and pass off skills to the next generation. And I feel a lot of not just nursing students, but students from all varieties of healthcare fields can relate to that very closely, as just fundamentally, there's not much thought and effort that's maybe being directed towards improving mentorship and improving maybe education for students in healthcare. But there is maybe big press conferences saying, hey, we're increasing spots by 100, 200, we're maybe perhaps throwing money around freely. However, there's not maybe much meaningful thought and consideration as to how you could best support students as they make this transition into the workforce. So given that, I think it's really important that we have these conversations, and I'm excited to, maybe share a student perspective in the panel we have this evening. So thank you.
That's great, thank you. Raj, do you have some opening comments to make?
Yes, for sure. Thank you, Karen, and thank you to Friends of Medicare for all the work they're doing and keeping the healthcare forefront on our daily challenges. It seems like there's a new challenge every day, but one challenge that we haven't been able to eliminate is the staffing challenges. And we're facing that across the board. We're seeing that all the way from top, from the doctors to nurses to the healthcare aides to all the way to support services. So I think today it's going to confirm that that challenge is across the board in entirety of healthcare. It doesn't matter what service you're talking about. We're facing it in the kitchens. We're facing it in delivery of food and for housekeeping. It's everywhere. And I have had actually some very personal, if I haven't had enough traumatizing experience of being in healthcare and representing members at this point. Just recently, both of my parents, elderly, needed healthcare, and I firsthand experienced the visiting and the hours in emergency spent. And today, in fact, I just came from the hospital having to take my dad in, and it was hours on end just to actually get into the emergency. The wait lines were right out the door because we were short nurses. There wasn't enough people to even triage. This is our today's, the moments ago healthcare.
Yeah. Well, thank you, Raj. And Cam.
Thanks, Karen, and thanks everybody for coming out to the AGM. I'm here for Friends of Medicare. For those that don't know me, my name is Cam Heenan, Leduc-Beaumont, and I have the honor of being the chapter president for the newest chapter in Leduc here. And we're super excited to have it up and going. And I'm looking at the attendees and see we have 89 in attendance and recognize a lot of the names. So once again, thank you all for coming out. I've been a paramedic in Alberta for this is my 20th year actually in November. Started my career in Hinton, moved into the city of Edmonton, and then I've worked a lot of rural areas such as St. Paul, Vilna, Smoky Lake, some of those smaller communities, and done some ground support as well for the flights that come in from those areas in northern Alberta into the Edmonton airport there. And it's just, when you talk to people and when you see people, and it's all across healthcare and not just paramedics that I talk to, but to just kind of second what the other commentators here have said, panelists have said, that it's just the burnout straight through, right, of everybody who's working, right, whether you're nurses, doctors, whether you're in the janitorial area, anything at all, right? We are just seeing burnout straight across the board. For our first responders out there, we are seeing how these people are rushing to all these calls and all these scenes and then going to the hospitals and just seconding what Ross said there. We're waiting with these critical patients in the emergency department. I mean, we have our training and we have our toolbox, but our toolbox is limited, right? We can't sit there for 1, 2, 3 hours and with these patients and try and keep them comfortable or try and stop that allergic reaction from getting better. These people need a higher level of care. We're providing the best care we can, but they need something higher, and it's leading to burnout, it's leading to moral injury, it's leading to a whole bunch of things that is wrong, right? I mean, currently EMS, most people last about 5 to 8 years. And then they're out of EMS, they're on to another career, they're on to something else. And that's wrong. We need to change that, right? And we really, really need to take steps forward to fix that. And I'm hoping to have some great conversations around that.
Okay, that's great. Thank you for your opening remarks. I want to remind people that if you have questions, to use the question and answer function, please. And we'll get to those after we have a few questions that we've agreed upon beforehand. So I just want to start by asking Raj to maybe describe sort of what are the typical pressures that your members face in a typical day, specifically related to the staffing crisis. We talked about a little bit in the opening remarks, but can you elaborate a little bit more on that?
Yes, for sure. So and of course, everybody heard that, I am from CUPE, so majority of my staff is support services. And staffing challenges for my members, like I said, it really stems from the top all the way down for us as well. So, we are always a skeleton crew as well, whether that comes to the housekeeping department or staffing clerks, trying to actually staff clerks. So staff, nurses or any disciplines. And it is immense amount of meetings trying to actually continuously on a daily basis have conversations with the employer, the hardship that financially and mentally and psychologically their members are facing with just not having enough staff. And then there is this one statement out there that they're 100%, which is true, that there is no people are losing interest in working in healthcare with the burnouts and everything. But there's also this other statement where it's intentional, right? And I constantly have these conversations and debates with the employer that, where, okay, there's a part of it that's intentional. There's part of it that is truly, yes, there isn't enough staff. But there's staff that can't put food on the table, and that shouldn't be the case. If we're that short in healthcare, that shouldn't be the case today. So my members are constantly struggling with just not enough workforce, and constantly making mistakes, and constantly just I would say there's a high level of increase time off and long-term, short-term disabilities that we're facing with workloads and burnouts, with simply just with one fact of staffing shortages.
Yeah, thank you. Eyasu, can you know, with nursing students that are working on the unit and trying to get their practicum, same question for you. Like, what's a typical day for a nursing student in Alberta, and what challenges do they have based on the staffing crisis that we have?
I feel nursing students are very impacted by the staffing crisis by having their ability to receive support from staff on the unit be compromised. And as an example, typically you would have experienced staff maybe like willing with the time and energy to maybe educate students on maybe various skills or various things that they don't feel super comfortable with engaging in for the first time. However, what I've seen personally and what I've heard a lot from students I've spoken to is there being just complete lack of available staff and available resources for students, which places them in like very awkward scenarios, or maybe they're being kind of pressured into doing things they don't feel super comfortable with as novices to healthcare. They're maybe even being placed in situations where they're delivering like most of the care with like little oversight or support, which for students who, again, maybe are not very comfortable or have self-doubt, can be a very distressing situation to be put in. And this results in moral injury for many students. And the outcome of this is this can leave students feeling a bit like with mixed feelings and a bit of distress related to their clinical experiences that ultimately contributes to maybe feelings of burnout and maybe them not wanting to be in the profession, which goes counterintuitive to what the message you're trying to send to nursing students. So I think like it's clear that having limited staffing on like units don't just simply impact the care that like patients receive and make lives of nurses and other health professionals worse. It also really compromises the learning environment for students. And that is something that has really like broad-standing ramifications.
So just to follow up on something that you said about oversight on the unit. What about students who are in their final placement, their final practicum? Is there challenges finding spots for practicum placements and finding suitable mentors for them?
Yes, absolutely. I actually remember overhearing a conversation on my last rotation where the nurses on the unit were honestly a bit irritated about having to take on a preceptor student due to how that detracts from their ability to deliver care on the unit with the very limited amount of hands they have. And situations like this obviously are just not ideal for either the staff on the unit nor the students, as you have staff who now are kind of maybe a bit irritated and even more stressed due to the responsibilities they have in caring and educating students. And students leave with like a worse experience overall as they have less accessibility of like a preceptor to help mentor them and fulfill the role that they are supposed to be fulfilling. So you are totally right that it is making it really difficult to educate the next generation of nurses and healthcare workers when, you know, you're just left so short-staffed.
Mm-hmm. And Cam, what typical pressures do paramedics and other allied staff face related to the staffing crisis? You kind of mentioned about being in emergency and waiting long periods, but I'm sure there's much more.
Absolutely. Yeah, I mean, thank you. So with the staffing crisis, it's, you know, when we don't have a paramedic, we have to drop the ambulance, right? This government can buy as many ambulances that they want in Suburbans and put them in stations. But if we don't have the folks to actually staff them, there's nobody to respond to those 911 calls. And for us, I mean, obviously we need 2 people, we need 2 paramedics on an ambulance in order to respond, right? And I mean, we're seeing when we have with this current continued staffing crisis, we are seeing our response times just get longer and longer and longer. The government that's not the case, that things have changed and things are getting better, same with Alberta Health Services, but that's simply not the case. I mean, changed the way they're actually measuring response times. Response times used to be based on when the call came in, and if it was holding because there was no ambulance available, that would count as time that was responded. So if somebody called and they waited an hour for an ambulance to actually get at the door, that was a 60-minute response time. Now what the government's doing is they're saying, well, once an ambulance is attached, it took 11 minutes for them to get there. So it's an 11-minute response time, but they don't count that other 49 minutes that call's just been sitting waiting, right? So we're seeing long response times. We're driving past stations that have, trucks that are just sitting there because there's nobody to staff them. And I mean, it's extremely tough on us, right? I mean, with those long response times, you're sitting there, you're going to these calls, and sometimes you may not make it to the call, and you might get put on 1, 2, 3, you might get diverted repeatedly. You might start thinking out that, oh, I'm going to help somebody up who's fallen to the ground, right? And they've hit their head, so it's lights and sirens. And then all of a sudden, a couple minutes into responding, the dispatch goes, nope, we need to clear you. We have a pediatric seizure we need you to go to now. And you're like, okay. So now you're thinking about your protocols and pediatric seizure, responding to that. And then they go, oh, no, wait, actually, another truck cleared. We're going to send you somewhere else. Now we need you to a cardiac arrest. And so now you're thinking about all those protocols. And now they're like, oh, no, now we're going to go to a narcotic overdose. And in the span of 10 minutes, you've gone through all these different things. You've been traumatized to all these different events. Never actually made it. You don't know the outcome of anyone else. And maybe you make it to that narcotic overdose and maybe you make a difference for that person, right? Or maybe you don't. There's been times where you just get cleared and they'll be like, oh, no, it's all good. We're going to send you back to station. And you're like, what just happened? I've done literally nothing and I'm trying to take care of myself, right? So I think that's what the staffing crisis is doing to us. Is it's really just undermining our mental well-being as paramedics, right? One of the things we also see with the staffing crisis is, we talk in the metro areas a lot about driving past stations and not having trucks filled, but in the rural areas, that's even worse. I talk to my friends who are paramedics out in the rural areas, and they can be, say, out in Slave Lake, and there could be no ambulance in High Prairie, and you'll see that those paramedics that are supposed to be stationed in Slave Lake spend their 12-hour shift driving back and forth between High Prairie, doing calls, providing cost coverage, right, and timing out their availability for the communities of Slave Lake or Wabasca or other areas, right? So, I mean, the staffing crisis just has this huge impact on availability to obviously the people for 911 calls, and then at the same time to paramedics and first responders mental health, like we know.
Well, and ideally we know that the healthcare system is really integrated, and one service relies on another. So I can imagine that a lot of times with emergencies backed up the way they are, that even leads to, where do you even take your patients to when they've contacted when EMS is there and the paramedics are there? And we've all heard about code reds, and it's it must be really challenging to even find a spot to bring them to receive that acute care. Do you find that that's worsened now, or?
It is. It's very different, right? I mean, when I started with the city, there were very strict stratification guidelines. You would go to certain hospitals for certain things, and you would never take other patients to other areas, right? And it was extremely strict. Now what I'm finding is because the system is so overwhelmed, and because even though a site might not do any ortho or anything related to that, but there's no room at a hospital that does, we'll take them there and then we'll transfer them later, right? I mean, the Strathcona and the Edmonton, right? Out in Stitch, we call it, out in Sherwood Park. There was a whole bunch of rules about who we could take and who we couldn't take there initially, right? Because they had no ability to admit. So if there was a chance that anybody had to be admitted, you couldn't go there. And initially the rule was nobody over 65. Well, I worked last weekend and we were taking people, I took somebody out there who I think was 92, right? And was going to be admitted, but they're like, there's nowhere else to go. It'll be the quickest for you to get a bed. It'll be the quickest for you to get out. We'll deal with the transfer later, right? And then what does that do for people on the other end? So yes, they might get a bed, they might do things, but how do they get home from these communities, right? I mean, what happens if somebody lives in Edmonton and they get taken out to Westview and Stony Plain, right? Or out to Leduc, which we go to a lot, right? Or even Devon. I transported to Devon for the first time in my career, right? The other day. And we're just seeing the use, and these people are just, how do they get home, and huge struggles there, right? So it's another tax on the system in the long term, right?
Mm-hmm. And so I guess for whoever wants to answer this first, please go ahead. But are there mechanisms to address the concerns that you have? And if there are mechanisms, do you get satisfactory resolution to the concerns that you raise, or is it just the same concerns that are being raised over and over and over again, and the resolution seems quite far down the line? So who would like to maybe answer that question?
I can go. It's good.
Go ahead.
So I mean, we do have we do, like, our management, they try, right? They do try as best they can with certain things, and I mean, they're only given so much money, and they have certain things that they have to take care of, obviously, right? And we do have, through Alberta Health Services, something called an RLS, reporting and learning system. When we were initially taken over by the city of Edmonton and we were taken over by Alberta Health Services, we actually had no response times at all. And us as paramedics, we did a campaign in the Edmonton area, and we filed just nonstop RLSs. And we were like, for any long response time, for any time you drive past a station, file one of these and say, this is an injury. And then finally, the employer came out with, okay, well, we don't have response times, but we'll look at getting them. And they got them, and we didn't agree with them, and that's a whole nother topic, right? But I mean, it was that whole thing. But I mean, as a whole, no, I mean, this government won't meet with us, won't talk with us, doesn't want to address our concerns, thinks everything better based on how they continually change how they look at things and measure system performance. But I mean, really, in the long term, no, we don't have a great way of addressing our concerns and making sure that we're heard and making sure that there's some form of follow-up.
Mm-hmm. So we already did talk about this a little bit, but Eyasu, maybe you could take this question. So what are some of the most significant impacts about the ongoing staffing crisis that you see for patients and families, but also then for you and your colleagues? Like you have mentioned some of them, but can you elaborate on that a little bit more for us?
Yeah, for sure. I could maybe give some more detailed examples of how it manifests on a day-to-day basis. In my most recent rotation at the university hospital, I actually saw, like, my classmates be put into a situation where they were totally responsible for the care of a specific patient without any sort of like buddy or support available, which is unusual and not typical practice for where you should be at in the program. And there was just ultimately very little recourse they had or anyone to go to, as they aren't very aware of their rights, especially when you're a student. You're not really aware of like what is university policy, what's the policy of AHS or anything similar. You don't know who to contact if you're like affiliated or if you can seek help from a union. And they were just kind of left to dry, and they were left with very, I guess you could say, maybe traumatic experiences, as they were like juggling situations that just totally were not supposed to be like something they're dealing with. And I think that is like just one example of how students quite routinely suffer as a consequence of the staffing crisis in ways that aren't very evident and aren't very like well publicized. And in other examples, it could just be how lack of staffing in places like long-term care can leave students feeling a bit distressed in terms of seeing maybe suboptimal care being provided due to the limitations of staffing in those sites, making students feel maybe a bit skeptical, or again, kind of like victims of like moral injury, and just having no way to do anything about it. There's like no formal pathways or to like make complaints. And again, as I have mentioned, students aren't aware, they don't want to feel like they're stepping on anyone's toes, so they don't do anything. But these impacts do stick with students. Like I do have memories that like I won't forget from previous clinical placements of maybe care that was not optimal, it should not have been delivered. And it is just something that like students face with on a very routine basis. And there doesn't seem to be the same amount of resources available that even like working healthcare professionals have access to.
Mm-hmm. Yeah, absolutely. There is something in the chat about, and I think Raj, maybe you're the best person to answer this, about commenting about long-term care specifically, the challenges, and it says that seniors aren't being fed, a tray is put in front of them and then they don't eat and then it's taken away. So representing members at the Edmonton General, those are continuing care patients or residents. Do you have any comments about what you know is impacting those residents because of the short staffing?
Yeah, for sure. So, CUPE has all sorts of when it comes to senior care lodges and stuff. And I think it's a whole one thing of, yes, the staffing shortages and not enough time. So, we have members that are able and know what the impact of that tray not getting there on time is going to be, of that cold food then getting to the residents and sitting there and knowing that there is no one to come and support. But to a degree, my staff is limited to actually provide that support. Not that they ever have that extra time to do that. That causes a lot of distress for our members, knowing, what, what their day was, how they were not able to help out those residents that they were there to care for, to do that day. And our rehab teams, our, therapy assistants, it's very challenging. And speaking a little bit to the recourses and options, there are few options, but it is beating around the bush. And by the time you come around the bush, it's you've only mentally, physically, emotionally, psychologically have hurt yourself. And there has been no solutions to this day. And I don't think that, especially this government now, has any plans to have any solutions to this, which is very unfortunate. So it really is just leading us all to, sort of leaving us with all this heavy work of emotionally, mentally, psychologically, carrying it around all day, just trying to beat that same drum and having no one responsible to listen and provide a response to.
Mm-hmm. Well, that actually is a good segue into the next question. And I have two questions, and then we'll get to some of the questions in the chat. But one is about dealing with moral distress. And we know mental health is suffering amongst healthcare workers, and particularly amongst high acuity areas and paramedics. And so, Cam, I'll actually ask you to answer about, are there strategies for dealing with this moral distress and mental health issues, and what other further supports are needed?
Yeah, I mean, there are, and it's getting better, but it's glacially slow. Like, let's just be very clear on that, right? Like, it's definitely moving in the right direction. When I started 20 years ago, there's probably one slide in my entire primary care paramedic program that talked about critical incident stress management, right? And that was it, right? And now people go through a lot more training. There's specific teams. It's definitely much better in Alberta Health Services, AHS. EMS has taken a better stance when it has come to it. They've actually put in some people to oversee it, but it's still not enough, right? I mean, we're fortunate in EMS and as first responders that we have access to the presumptive coverage under WCB for PTSD, and we're able to access that. And I know lots, including myself, have. Right, it's a tough career, and we need to access that, and you're able to go and chat with a psychologist and do your things. But the problem is those psychologists, they're backed up. It takes a while to get in, even when you do have one, and even when you have your own, it can take 4 to 6 weeks to still get in the door once you've already done it. Right, I mean, it's a very difficult career for people to go in, and we definitely need more supports for people, right? And I think one of the ways we do that is we look to make sure that we're taking care of the workers, right? And we're taking care of the staff, and we're taking care of the professionals that are out there working. Right now, if it's a busy shift and I need a break, it's all they'll give me is 20 minutes. That's it. And I have to call and ask for that. And if I have to be going back to back to back for calls, right? I don't get a half hour. I don't get an hour. They'll put you out of service for 20 minutes. And that includes drive time to the station to heat up my food. And then I automatically get put back in service to go do my next call. And that's a huge issue, right? I mean, that's not right at all, right? In a 12-hour shift, that's what you may or may not get. So it's a struggle, and we need to make sure that we're doing things that are more proactive for people to take care of their mental health. And I still find we're still very reactive, right? But it is moving in the right direction. It's just glacially slow. I can't stress that enough.
Eyasu, you mentioned that some nursing students are leaving the profession, and I forget what the statistic is, but it's actually quite an alarmingly high number of people who leave the profession after 5 years. And so I don't know if you know what the statistic is now about people leaving, but also strategies for nursing students to deal with some of the distress that you're talking about not being able to provide the type of care and have the mentorship. Because it is, you know, as you move from novice to more expert in your care, it relies on having good experiences and good learning opportunities. And so, yeah, what would you say about that moral distress piece?
Yeah, for sure. Research from the CFNU demonstrated that over half of all nurses are currently considering leaving their positions in like the year ahead. So it is an alarmingly high rate. And I think it is especially high with students for the reasons I've mentioned earlier, in terms of just, again, the limited supports you receive and some of the difficult situations you are placed in. And in terms of supports that are available, what I will say is that they are quite limited, as in the first year, all students are required to take some mandatory self-care seminars that like preach, you know, sleep, take care of yourself, different platitudes. However, when you are like really in the thick of it, you don't get much support in reality when you're kind of juggling 3 to 4 days a week of unpaid clinical shifts, you know, papers, exams, commuting, often doing part-time work. It is a very grueling cycle that doesn't allow you to maybe decompress or even reflect on some of the maybe challenging or disturbing experiences you've had in the clinical environment. And there is limited support even universities offer, like they allow you to access maybe like one psychologist amongst like thousands of students, which ends up making it be multiple week waits to access care, which when you consider how packed student schedules typically are, most students would rather not bother even seeking care altogether. So it is a very unideal situation that nursing students face and other healthcare students as well. So more supports are most definitely needed.
Thanks. I said I had 2 questions, but I think because there's so many good questions in the question and answer, we're going to skip over and we'll come back to that one if we have time. But Chris, I think you had offered to help moderate the questions in the question and answer section. So
sure, yeah, I can read out.
Yeah, sure.
Because I have them open. So maybe I'll read 2, and then when I share it, everyone can see it. So there's a question from Margaret about Bill 22, the division of healthcare into Alberta, and how that will affect the work you all do in terms of this. And then there's another question from Karen that just asks if there's statistics to back up what you're all saying, which I know CFNU and HSA and others have done work on that. So maybe there's things you can point to. So those are the first 2 questions.
Okay, so does anybody want to talk about Bill 22 right now? And do we know the full impacts of what that's going to look like? I think that there's a lot of questions. Maybe Cam, do you want to comment on that?
Yeah, no, for sure. I think, yeah, Bill 22 is concerning, right? I mean, I think part of the problem is it's throwing more upheaval into the healthcare system when workers are looking for stability, right? When we need to attract other workers from other places, we need stability. We need a government that is just saying, you know what, AHS is kind of getting things figured out. Things are like, I feel in AHS EMS, we're finally, after 10 years, getting things figured out. We're finally moving in the right direction. We're finally kind of figuring out our place within the organization. And now this is going, well, what's going to happen, right? We're seeing the privatization of EMS services in some of our core areas, in Edmonton and in Calgary and in other rural areas. And that really worries me, right? Because what, you know, that takes away the ability for paramedics who are trying to get to retirement. It takes away their ability to have a job where they can do so and not just respond to 911 calls all the time, right? Or not be driving all throughout the night, right? I mean, we have, you look at that transfer group that's specific to taking people from the airport to the hospitals in the Edmonton area. I chat with my friends out there, and I've worked that shift before, those shifts, and vast majority of them are people who are, you know, 4 or 5 years from retirement, because they don't get tasked with 911 calls, it gives them the opportunity to utilize they're highly trained. They have a ton of experience. We're talking 30 years plus is usually in the passenger seat and the driver's seat of those ambulances. And they're there dealing with these critical patients as they come in on the airplane, right? And I think that's absolutely huge. And I think that's where I get concerned is I don't know what's going to happen with our ability to see paramedics move around and kind of be able to stay in the career past that 5 to 8 year thing, right? So and that's where Bill 22 is concerning me.
And then, yeah, so maybe you could comment about the statistics. I know that you were involved with the toolkit for retention that CFNU has had a webinar on, and I know that they have a lot of great reports, but is there like a link to statistics that you were mentioning, or if the other panelists too, if there's any specific statistics that you want to mention or where we could access those, that would be great.
For sure. The statistics I referenced regarding the number of nurses thinking of quitting can be accessed on the CFNU website. I can also put it in the chat. And regarding the nursing retention toolkit, it was an effort put together by Canada's Chief Nursing Officer, Dr. Lee Chapman, and it had participants from organizations like the CFNU, the Canadian Nurses Association, as well as the Canadian Nursing Students Association, which is who I represented at the time. And yeah, there are a lot of very actionable recommendations that various health authorities can take to support the retention of nurses, and it could even be pretty applicable to other healthcare professions as well. Things like safe staffing, reducing administrative burden, making work life more flexible and balanced. It's a very comprehensive report, and I will link both of them in just a moment.
Chris, can we go through maybe 2 more questions at a time, and then we'll try to get as many of them as possible.
Yeah, so there's from Tyler's one about EMS, so maybe just to Cam, that many EMS folks are on contract only and not being scheduled full-time hours, benefits, that kind of thing. So that is a concern. And then for everyone, Nancy's asking, how can we explain in layman terms our staffing crisis to Albertans? Basically, yeah, I'll leave it at that, but you can see the full question in the Q&A.
Yeah, so we still have paramedics that are on contract. It's not as bad as it was. It's definitely got better. The employer AHS EMS is doing a better job of giving people permanent full-time positions and making sure that people have access to benefits and pension, and they're not just 6 months less a day contracts. There's still a struggle there, though, that not everybody has access to full-time, and we do have a ton of vacancies still. So I mean, even though we do have more people being offered permanent full-time, we still have vacancies. Like I went on the other day and was looking to pick up some shifts, and it's easy. I can pick up, there's about 30 different choices a day in the Edmonton area and that's the surrounding communities, that's the transfer division, that's the 911, and that's just obviously too many, right? And that doesn't even include the Oilers playoff run and the extra staffing they're trying to put on for that, right? So I mean, it's better, but we just still don't even have the trained professionals to fill vacancies, right? So
Raj, did you want to try and tackle the question of Nancy's? How do we explain it in layman's terms so the public understands? I mean, I think anybody who's accessing the system can see what the challenges are when they're waiting a long time for care. But, and you've talked about your parents just needing care, and you saw firsthand what that's like. But how would you describe that to somebody who doesn't have interactions with the healthcare system right now? What the problems are in just plain language?
Yeah. And I think these last couple bills that are being debated right now and making its way up with the privatization agenda, I think it's difficult to drive some of these points home for someone who's actually not in active need of healthcare facilities or any of the programs. But it's pretty easy, I find, to have conversations, because when you're a healthcare activist and it's in your blood, and those conversations are everywhere. When you start explaining a situation, so for example, if I'm sharing with somebody how my parents care, or the long waits and the lineups out the door, and some of the frustrations and some of the scenes that we saw just waiting in the line, and us from inside the healthcare who knows this, and the reactions from those people. When you share situations like that, I think they drive personally home more than trying to explain and express the bills and the changes and the impacts of all these things that are going to have down the road, versus what is it today? What does this look like? What do our workers and members see and face every day? And what happens if you do go to the healthcare system, right? I've shared my parents' example, even just between this afternoon and now, and it was just mind-blowing, right? We had shortage of nurses, and we had EMS, and EMS obviously was going to take somewhat of a priority, but then there was also people that couldn't breathe, and having difficulty breathing, and the nurse can only talk to one person at a time, and it was such a struggle, and then getting in and actually finding space in the hallways and in the corners, and it's very unfortunate, but that's just where we're at today.
Okay, Chris, a couple more, and then I think we're going to have to bring the panel to a close, but do you want to?
Yeah, I'm just doing them in order we got them, so that's my screening. So I'll do 2 more, and then maybe we can do a wrap up, and if there's specific questions that weren't answered, people can always reach out. So the first one will probably be pretty easy, from Donna. Do you think the AHS senior management are using the lack of healthcare frontline staff as a strategy to privatize healthcare? Why are they not hiring more workers? And then Judy asked about a friend who was in the transition area of a hospital, that a bunch of people were there a long time because there was no place to transition them to, no home to go to, and they remain in hospital. Just curious how real that is as a concern, or how serious that is in the hospitals.
Who would like to take the question first about privatization? Is this an excuse for privatization? I have an opinion about it, but I'll let the panelists say.
I mean, I don't know if it's necessarily Alberta Health Services that has that position, right? But I do worry, and I do feel that obviously the government has that position, right? I think that the government is looking to break healthcare. I think they're looking to bring in some terrible legislation. I think they're looking to make things extremely difficult for people to access healthcare. I'm terribly horrified that they're going to try and privatize whatever they can, how much as they can, and so yeah, I do think that the government is out there, but I don't necessarily think Alberta Health Services is doing that, right? I mean, I think there's only so many workers to go around, and we need to find ways to train people and get them into those positions, and there's other things that can be done, but yeah, no, I don't think it's necessarily AHS.
Well, and I would definitely say, I mean, we see with addictions and mental health, for example, right? We know that there's this agenda for privatization, and when the government protests, they're protesting too much. We can see it. There's lack of transparency about the plans. There's lack of transparency about the staffing plans that are supposed to be in place everywhere. And we know that privatization is happening, and this is giving an excuse to say, look, the public system isn't working. But when you underfund the public system and you don't support it properly, it makes it look like the only alternative is private. And so that's a huge concern for everybody in Friends of Medicare and everybody who provides care, because we know that the publicly funded and publicly delivered is the most fair way of allocating healthcare. And so, sorry, Chris, the other question was about the transition. Like, is that real? Like, is that what the question?
Yeah, like how serious is that as an issue of people being stuck waiting to be sent somewhere?
Does anybody have experience with their patients not being able to go anywhere and being stuck in the hospital or being sent to places where it's not appropriate for them to go?
For example, the motels that we've had some patients visiting lately, yeah, that would be a very prime example. Yeah, I mean, I think You know, I think it's definitely real, especially in resident care, in senior care, where they're coming into facilities, going into the units, and even nursing in our active treatments. You know, we're having wrong patients on wrong units, and that staff is not trained, and that's not what they're equipped with. We're having dementia patients on stroke units having dementia patients. It's a real disaster, and simply is that because, yes, the employers don't have the right capacity of beds and the care staff? Is it, you know, what is it? And I think it's a multifaceted problem that our government is not really willing to address, and in fact just putting all these bills and distractions in place for the employers to be actually running the facilities and fixing the problems. We're just being rerouted and redirected into further mess. And again, yeah, just going back to creating privatization.
Okay, Chris, I'm going to say 2 more questions and then we should wrap things up. Although apparently we could have booked double the time for this.
Yes, we could talk for a long time. So there's a couple questions about action. So I can maybe group that as a question of, you know, Trevor's asking what action we can take to disrupt business and the flow of profit to the folks who are trying to benefit off of this deteriorating system and the staffing situation. How do we create problems for them? Because there's the profiteers. There's also questions about how citizens can raise this. Is it the premier? Is it the health minister? There's a few of those in there. So maybe that's a good way to wrap of just what actions should happen, or how do we take action on this?
I'm going to give an opportunity for each panelist to say just a few words about that. And then Chris, I'm going to actually ask you to weigh in on that as well, since that is basically a mandate of Friends of Medicare. So why don't we start with Raj and Eyasu, and then we'll end with Cam, and then I'll ask you to say a few comments. Okay, Chris?
Sure.
Thank you. Thank you, Karen. There are ways, but they're definitely difficult to drive some of these points home. But there's definitely those worthwhile conversations. You know, definitely I am in constant conversations with our MLAs and our counselors, and you know, expressing the personal experience of our members, the day-to-day struggles, and personal tainted experience of using the healthcare and also working in the healthcare, right? And when you hear these MLAs actually using and referring to those in the legislatures as, you know, healthcare is being debated, that's one way. The others, there are definitely some other ways. It's definitely not easy, but you know, I use always an example of our housekeeping department management that came up with a really creative solution of you know, having a lot of immigrant workers where, you know, they want to ensure that they understand how the cleaning is done and what products are used, and how long they need to be left alone, and what the outcome would be if they're not. So they get them to actually show and sort of a show and tell kind of experience that they do. It's a live mock room. And I think it's going to have to come down to these leaders, these politicians making these decisions in healthcare, to actually see what that live care and the treatment and what that looks like. What is the live experience? It's easy to make those decisions when you are not in hands-on and you don't see that, and it's just you know, I'm going to make decisions just because I can drive away from that mentality with the 0 care hours, right? That's where our legislation unfortunately is today, is 0 care hours. I think we need to put up some stretchers and do some demos to express that. It's not an easy way out. There's never easy solutions to any of these big problems. But I think if we Albertans get creative, we could show that demonstrations.
Thank you, Raj. Yeah, so you're next, please.
Thank you. I think in order to take action on the issues we've talked about, it really boils down to talking to the people you know, especially those who maybe don't have that frontline exposure or experience in healthcare, as they may open up the news and hear like the buzzwords of like refocusing healthcare, optimizing, creating efficiencies in some like press release when it comes to the restructuring of Alberta Health Services, for example, or like whatever spin certain elected officials who have no connection to healthcare do to justify their harmful actions. But I think if you can really like link how, you know, working conditions of like nurses, physicians, various healthcare workers directly impact the care that's being delivered to patients, and that they're very inseparable ultimately. And if you do make this investment in their recruitment and retention and staff, that's what's truly going to unlock better and more accessible healthcare service in the province that will allow people to maybe be a bit more aware and take the necessary actions themselves in tackling the crisis in healthcare. Because if people are just led to believe what's being pushed by the current government, that like, oh, it's all about inefficiency, you know, if we just like restructure and take one board down to 14 boards or whatever they're currently doing, like you will somehow create a better system. Like, no, you have to maybe use some of the leverage you have as a healthcare professional to like say like it really comes down to an issue of staffing, and not only communicating to people outside of healthcare, but also like within healthcare, whether you're a worker or a student, that things can get better. And that like, if we do come together as a collective and voice our concerns regarding, you know, working conditions, patient care environments, as well as some student learning conditions, I think we can see like positive change and like progress surrounding things like staffing, minimum care hours, and just like ensuring our public health care system continues to exist for the province.
Thank you. Second last words to Cam.
Yeah, I'm just going to echo exactly what the other panelists have said, right? Is we need to connect with the MLAs, right? And we need to pressure the government to listen. We need to have more folks get involved with groups like this, with Friends of Medicare, right? And then we need this group to really build, and we need to go and we need to have those conversations with the MLAs, and we need to make them listen, right? And we need to take them stats, and we need to take them personal experiences, and we need to have those conversations with them. And it's going to be tough. It's going to be difficult, right? Because we're changing, you know, their complete thought process, right? And we're going to have to reprogram them, for lack of a better term, right? But there's nothing we can do if they're not going to listen to us, and they're just going to keep making changes without listening to groups like Friends of Medicare, without you know, people who represent workers, you know, and they're just going to continue down this path of just absolutely destroying our healthcare system, which is and breaking our workers, and it's not going to solve the crisis at all, and that is completely wrong on so many different levels. So that's my urge to people, is like these other panelists have said, is go meet with your MLAs, have those conversations, and try and institute some change that way.
Chris, to you. You can wrap up the panel discussion.
I exist. I'm not just a voice. Thanks, Karen, and thanks, everyone. I'll just say a couple things, and then I have a report later where I might say a couple more on this, because we know that this is the real issue in the healthcare system. It's why we have this panel. It's why Albertans are experiencing a lack of access to care. It's because of staffing. And so the issues they're feeling, the closures, the wait lists, and so on, it's all staffing. We know that's the issue. So, you know, join FOM and join our campaigns, Friends of Medicare, to fight on that. But also, you know, we need to prioritize it in our campaigns more over the coming year. We also need to support the bargaining of basically every healthcare worker in the province this year as they go forward. And if there's job action or rallies or things, people need to show up and show that we support healthcare workers, because their work conditions are our care conditions. We all know that. So that'll be important. And then pointing to the profiteers. Corporations are trying to make a lot of money right now on healthcare. They see an opportunity everywhere. They are everywhere, not to sound paranoid, but go to a government consultation on healthcare right now. They're everywhere looking to make a dollar. And we need to call that out and make it uncomfortable for them, because when we do that, we have seen governments back down when there's things like access fees or other things proposed where it's about profit, not care. The public's on board. So that's not a huge answer, but just, you know, join us, support healthcare workers, and there's always more actions and campaigns on our website that folks can take.
Well, thank you to the panelists. Thank you very much. And like I said, obviously we could have booked a whole nother hour to talk and answer questions, but we appreciate your insights and really appreciate you coming for the this panelist portion of the AGM. So thank you with gratitude, and we appreciate all the work that you're doing, all of you. Thank you so much.